Hello, my name is Karen Pennington. I am a registered dietitian and diabetes care and education specialist at Complete Health. Let's talk about how we will monitor your progress to control your diabetes or prediabetes. The A1c is a lab test that provides a 2 to 3 month average of your blood sugar levels and shows how your glucose is doing over time. Research shows that by keeping your A1c in target range, you can prevent many of the complications from diabetes. Keeping your A1c in target will allow you to feel your best and prevent health issues in the future. The American Diabetes Association suggests those with diabetes should keep A1c at 7% or less. This corresponds to an average glucose of about 150 milligrams. You and your provider may decide on a different goal, so make sure to discuss this at your next visit. The A1c should be checked every 3 to 4 months. Be sure to always know your A1c. While an A1c test gives you an overall blood sugar average, it is helpful to test your glucose at home. You can use information from testing to guide your eating and exercise habits. It also helps you and your provider to know if your medication is working. Blood glucose supplies are covered by all insurance companies. There are various brands of blood glucose meters, but they all work the same way. So how do you use a glucose meter? First, wash your hands to make sure they are clean. By using warm water, you soften the skin, encourage blood flow, and make it easier to get the sample. Load the needle or lancet into the lancet device. Next, adjust the depth of the needle on your lancet device. A setting of 2 or 3 is typically recommended. Cock your lancet device and insert the test strip into the meter. This will turn the meter on. Hold the tip of the lancet device on the side of your finger, close to the third joint. Don't stick the tip of your finger, as this can be more painful. You probably will not feel the stick, and you will not see the blood drop until you squeeze your finger. Most meters require very small blood samples. Apply the blood to the strip in the designated place and wait for the result. This typically only takes a few seconds. The best time to test is before you eat in the morning and 1 to 2 hours after you eat in the evening. Ask your provider how often you should test. According to the American Diabetes Association, your blood sugar should be from 70 to 180 milligrams. However, your provider may give you a specific target based on your unique situation. You should make an appointment with your provider if your blood sugar is consistently above 240 milligrams. Please contact your provider before going to the emergency department or urgent care for high glucose levels. Rarely is a high blood sugar an emergency. Until you talk with your provider, drink plenty of sugar-free beverages, preferably water, no fruit juice, soda, or sweet tea, and keep testing your blood sugar. Contact your care team if your glucose is below 70 milligrams with symptoms of feeling weak, shaky, or sweaty. This could be low blood sugar, also called hypoglycemia. Most people with type 2 diabetes do not have to worry about low blood sugar, as only insulin and one type of diabetes tablet can cause hypoglycemia. Be sure to ask your provider if any of your medications can cause low blood sugar. Take your meter or blood sugar results with you to all appointments. Another way to test glucose levels is a continuous glucose monitor. Ask your provider if this is right for you. Visit us online at completehealth.com/diabetes to find more educational materials and to contact your care team.